Now, today, I would like to give an account on a very important issue. That is how we could enhance the treatment protocols for COVID-19 patients, in particular how we could protect the elderly. Since the start of the fifth wave, we have over 500,000 positive cases. Omicron is highly transmissible and is spreading really quickly, and that's really alarming. But then people usually have relatively mild symptoms. With the figures announced by the Center for Health Protection, as I mentioned, there are some 500,000 positive cases. For at least 100,000 cases, the patients are asymptomatic. That's because vaccination over the past period has helped to effectively reduce the number of serious cases and death cases. But then, unfortunately, in the fifth wave of the epidemic, we have seen a surge in fatalities. As at yesterday, the 8th of March, in this wave of the epidemic, there's a total of 2,365 death cases. So some 2,000 people passed away. This is really sad. And many of these of the deceased were the elderly. The median age is over 80 years old. Many of them have underlying conditions, and more than half of them stayed at residential care homes for the elderly. But we must spare no effort in protecting the lives of the elderly. We also want to enhance their health condition. So we have taken on the advice given by mainland experts. In particular, Professor Liang Wannian has been in Hong Kong for over a week, and he has been working non-stop to help us. And so at this point, our focus should be on reducing severe cases, death, and the spread of the disease. So we need to expand the capacity of hospitals to treat COVID-19 patients. We want to put infected patients in hospitals centrally, and we need to focus our resources in saving patients and preventing the condition from deteriorating into severe or even critical cases, and we're still to prevent them from death. So we together with the hospital authority will take the following measures. Firstly, for the Queen Elizabeth Hospital, it will be turned into a designated hospital for the treatment of COVID-19. In the next 4 days, we will strive to transfer non-COVID-19 patients who are now in the Queen Elizabeth Hospital to other hospitals. In other words, starting from today, the Queen Elizabeth Hospital will no longer admit non-COVID-19 patients. The Fire Services Department will be giving full support in this transfer exercise for patients to go to other hospitals, and for patients at the Accident and Emergency Department to go to other hospitals. And then for the North Lantau Hospital and the Tin Shui Wai Hospital have been converted into COVID-19 hospitals with some 900 beds. And then soon, about half of the general ward beds, convalescence beds, and so on, will be turned into COVID-19 beds. This is a major exercise that involves about 9,000 beds. Of course, we would like to have the support and cooperation of private hospitals too, so they could take on some of the patients from the hospital authority. That's the second measure. The third measure is that I have put a request to the central authorities to send us medical teams so that we could enhance our capacity to handle severe cases. We could enhance our facilities at 2 locations. That is the North Lantau Infection Control Center, and also there's a temporary hospital with 800 plus negative pressure beds. That's the North Lantau facility, and then we're also talking about the Asia World Expo facilities. Here, we could have enhanced capacity to deal with severe cases. The fourth measure is that there's going to be emergency hospital to be built by the main authorities for us in Lok Ma Chau Loop, and it will be supported by mainland medical staff. We hope that these facilities will be commissioned in phases starting from April. All these facilities together could substantially enhance our capacity as public hospitals to treat COVID patients, so that we could prevent patients from becoming severe cases because of insufficient care and treatment. Now, with these facilities that I mentioned, we will be able to provide about 16,000 COVID-19 beds. But then if the epidemic remains at this high level, then we cannot achieve what Professor Liang Wannian said, that we should have beds ready for patients. So then we need triaging and treatment for different groups of patients, including the elderly. Here we are talking about a number of measures. Firstly, we're going to set up more isolation and occasional care facilities in the community for the elderly. For elderly patients whose condition has stabilized or whose condition is mild, they could go to these facilities and recover under medical supervision. Otherwise, their conditions may vary, and then if they go back to the residential care homes, then their condition may take a turn for the worse all of a sudden. So for these isolation and occasional care facilities in the community for the elderly patients, they are to be operated by the Social Welfare Department. At the Asia World Expo, there are over 1,000 beds already in operation, and then there are 2 indoor games halls that have been converted into occasional care facilities. That is the Choi Wan Road Sports Stadium and the Shekip May Sports Stadium. Now, when we have trained enough staff, there will be other facilities to come into operation at the Kai Tak Cruise Terminal. There will be 1,200 beds for isolation and occasional care purpose. And then we have 7 other indoor games halls which could be converted in the same way to become isolation and occasional care facilities in a community. But then what we lack most is that as each of these occasional care centers, we need to have sufficient health care staff and carers. That's why I have asked private hospitals to give us assistance. In terms of carers, we are taking a parallel approach. On the one hand, we are trying our best to enhance the incentives to recruit more local carers. At the same time, we're going to import carers from the mainland. The second specific measure is to give more support to residential care homes for the elderly and the disabled, RCHEs and RCHDs. For some of these homes, we're going to provide closed-loop management. That means there will be dedicated hotels and transportation. So carers and workers taking care of the elderly would work in a closed-loop arrangement. They don't need to go back home or go into the community, and then they may get infected and then they bring the disease back to the homes. We don't want that. So, of course, we would first focus on homes without infection yet to start with this closed-loop approach. We don't have much time left, but these homes will have the priority for us to implement closed-loop management and enhanced protection for these homes. And then we need to protect sufficient personal protective equipment and masks for the workers. And then third measure, we hope that within 2 weeks, that is before the 18th of March, because we mentioned that a few days ago. So before the 18th of March, we will complete vaccination for all residents in these care homes in Hong Kong, and I mean the completion of the first dose. And then And the fourth measure is that for elderly patients with mild symptoms, we will provide isolation at home, and then there will be an enhanced COVID-19 pack with rapid test kits, proprietary Chinese medicine, thermometers, and so on. And then we will take the initiative. In other words, we don't need the elderly to call us. There will be healthcare workers calling these elderly isolating at home to ask about their health condition so they could do clinical assessment or remote consultation. So for elderly in home isolation, there will be a dedicated hotline for them. And then a third point is, now if these elderly patients need to see a doctor in this remote consultation, they will be given priority, because the hospital authority now has 17 designated COVID clinic. They could get priority appointments, and they could book our dedicated transport to go to these clinics. And if at the clinic it's found that there are signs of the condition deteriorating for these elderly patients in home isolation, they will be sent to hospital at once for a treatment.
Medication is most important when it comes to prevention of serious cases. I'm happy to announce that after concerted efforts from various parties, the hospital authority has purchased enough oral agents for fighting COVID. One is being used, and the other will arrive in Hong Kong next week. I'm most grateful to these two drug manufacturers, i.e. Pfizer and MSD, for their efforts for the benefit of Hong Kong. So the two oral agents against COVID will arrive at Hong Kong very soon. And of course, in every aspect of our work, including the conversion of Queen Elizabeth Hospital to a dedicated hospital for COVID, are bound to impact on our community. I appeal to everyone in Hong Kong to stand united, to collaborate with the government in various measures, including maintaining our social distancing measures to prevent infection, and we need to have more community isolation facilities. For the confirmed cases, please move into CIFs according to our allocation and placement, so as to reduce the risk of spreading the disease to their family members and to members of the public. Now, I'm sure we can triumph in this war against the pandemic.